Bloodborne Pathogens, Part 2. Objectives: understand the following: symptoms of bloodborne diseases, exposure control plan, and how to obtain a copy of the written plan, appropriate methods for recognizing tasks and other activities that may involve exposure to blood and other potentially infectious materials or OPIMs, use and limitations of methods that will prevent or reduce exposure. Symptoms of bloodborne diseases: hepatitis B virus. Symptoms of acute HBV, if they appear, include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored bowel movements, joint pain, and jaundice, which is a yellow color in the skin or the eyes. Symptoms may appear 90 days or 3 months after exposure, anytime between 6 weeks and 6 months after exposure, and could even occur 20 or 30 years after exposure. Many people with HBV have no symptoms but can still spread the virus. Hepatitis C virus. Symptoms of HCV include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, gray-colored bowel movements, joint pain, jaundice, which is yellow color in the skin or eyes. Human immunodeficiency virus, or HIV. Symptoms of HIV include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and ulcers in the mouth. Symptoms may appear within a few weeks after infection or up to 10 years or longer. Many people with HIV have no symptoms, but it is still affecting their body. Exposure control plan. Elements of the plan: exposure determination, implementation of universal precautions, identification and use of engineering and work practice controls, provisions for personal protective equipment, housekeeping measures, requirements for HIV and HBV research labs and production facilities, availability of hepatitis B vaccinations for all employees with occupational exposure, procedure for evaluating exposure incidents, availability of post-exposure evaluation and follow-up for any occupationally exposed employee who experiences an exposure incident, use of labels and signs to communicate hazards, provision for information and training, record-keeping process, documentation of annual consideration of safer medical devices, and documentation of solicitation of input. Methods to recognize exposure. Occupational exposure to bloodborne pathogens is not limited to occupations or employment in one or a few industries. It is based on whether or not employees are reasonably anticipated to have skin, eye, mucous membrane, or other contact with blood or other potentially infectious materials that may result from the performance of an employee's duties. One way to determine occupational exposure is to recognize tasks such as cleansing and bandaging cuts, burns, or other open wounds, providing emergency treatment of traumatic wounds, performing cardiopulmonary resuscitation or CPR, cleaning up spilled blood or OPIMs. And I should note, TRIASIM employees are not permitted to clean up spilled blood or OPIMs. If that occurs, TRIASIM will contract with a third-party company to do so. Decontaminating surfaces and reusable equipment, picking up waste baskets and bags which often contain needles, handling infectious waste, and exposure to others who may bite. Controls to prevent exposure include engineering controls, work practices, and personal protective equipment. Engineering controls reduce exposure by either removing or isolating the hazard or isolating the worker from exposure, and they are limited in effectiveness to proper selection, examination, and maintenance. Work practices alter the manner in which a task is performed, and they can consist of restricting eating, drinking, smoking, applying cosmetics or lip balm, and handling contact lenses, preventing the storage of food or drink in refrigerators or other locations where blood or OPIMs are kept, routinely checking equipment for contamination and decontaminating it prior to servicing and shipping, providing and requiring the use of hand washing facilities, washing hands when gloves are removed as soon as possible after skin contact with blood or OPIMs, and always using gloves when cleaning up any blood spills. Personal protective equipment must be used if engineering and work practices do not eliminate exposure, and these normally consist of gloves, face shields and/or masks, eye protection, and other appropriate PPE. It's appropriate only if it prevents blood or OPIMs from passing through or reaching clothes or the body. Housekeeping. Work practices related to housekeeping include cleaning and decontaminating the environment that has been contaminated with blood or OPIM, decontaminating work surfaces after completion of procedures, immediately after spills of blood or OPIMs, removing and replacing protective coverings when contaminated, regularly inspecting and decontaminating reusable receptacles that are likely to become contaminated, using mechanical means to pick up contaminated broken glass, storing or processing reusable sharps in a way that ensures safe handling, placing discarded contaminated sharps in labeled or color-coded containers that are closable, puncture-resistant, and leak-proof. Universal precautions. These are precautionary measures based on the principle that all blood and OPIM are treated as if known to be infectious for HIV, HPV, or other bloodborne pathogens. These include hand hygiene, use of gloves, gowns, masks, eye protection, or face shield, depending on the anticipated exposure, and safe injection practices.